So I want to talk about mental health and the problem with how we look at mental health, whether it's our own or other people's mental health. So this is super important because almost everybody I know, almost everyone, I'm trying to think of an exception. People I know personally, everyone deals with this in their family or with themselves. If they don't have it in their family or themselves, they have it in the workplace or in friend groups or social groups. It impacts all of us. I'm sure it impacts you on some level, whether it's your own, a family member's, a friend's, a boss's, somebody in your social network. So this is a pervasive issue. It's just what I want to start talking about here on a public platform is I think it's super important when there is a mental wellness issue to start talking about it differently. So rather than saying, I am depressed, or I am anxious, or I am bipolar, and so on, that we start to train ourselves to talk about others with mental illness and ourselves differently. So rather than saying I am, because if you were a cancer patient or somebody you knew had cancer, you would not say you are cancer or I am cancer or cancerous. You would not do that because, of course, we know with cancer or heart disease or COVID that you aren't COVID, you aren't heart disease, you aren't cancer, but you have been attacked by some other thing that's impacting your health. This is the same thing with mental illness. It's exactly the same, but there's this weird way that we see it, and the medical community does not help in any way, shape, or form. I think it's because they have not been properly trained. There's just sort of a problem and a blindness. There's mental illness blindness in our society. We just can't seem to see what it is. And it's just like cancer. It's just like heart disease. It's just like COVID in the sense that something has attacked our system or someone else's system so that their brain function doesn't work, just like heart function may not work or cellular function may not work because of the cancer. It's just the same. So if you are concerned about yourself because you're seeing symptoms, and the thing about the symptoms with mental illness is they come out in the form of behaviors. And this is where the problem is. We tend to think that we are in charge of all our behaviors, all our thoughts. And that may be true for a good portion of people. If, on the other hand, you experience somebody in your life, a family member, like we said, somebody in your social sphere, somebody close in, or within yourself, you see that there are behaviors that just seem off. They just seem off, or they seem patently disturbing. That is a symptom. That is not the person. Just like with cancer, somebody starts experiencing pain or fatigue or headaches. Those are symptoms. So behaviors are symptoms when they seem off. Behaviors, let's just say it again, are symptoms of something else. This is something I really want to talk about more publicly because I just don't see it talked about. I maybe I'm just not in the right algorithms. I don't see it anywhere else. So I'm just going to start talking about it. Behaviors are symptoms. And as a coach, somebody who works with coaching people through, behavior modification, it's kind of like some cognitive behavioral stuff with life coaching that we kind of work on in parallel to therapists who use it in a different way, more medically and clinically. Life coaches use some of the same tools, and we're working on similar things, once somebody's hit a baseline where they're well and they're not mentally ill. And so, in doing that kind of work, and also just being a human in our world where mental illness is a fact of life. Again, like I opened this with, everyone's been touched, you've been touched by it, I am 100% sure. I'm stretching my mind right now to think of friends, family, people at work. I see it everywhere. And so we have to have this conversation. It's so important to start to see mental illness is not something that somebody is. This is the behavioral symptoms and manifestations show a disease that has attacked a person's brain. And we have to, and I'm sure medical professionals will say, oh, it's not a disease, blah, 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 blah. Well, start doing something to actually help people, because mental illness treatment has not advanced since the 1980s, or even earlier. We're still doing the same things that have always been done. Pills, even, electroshock therapy, even though it's way more humane now. We're still, basically incarcerating people. Tell me where I'm wrong, because it's either a pill somebody takes or shot, or, some kind of, strong intervention with something like electrocution or incarceration. This is pretty much where we still are with mental illness. I'm passionate because I have two people in my family who are strongly impacted by this. And I just see madness within the treatment of it. I think the treatment of mental illness actually has a mental illness to it. There's a mental illness component to treating mental illness where, like I said earlier, they're blinders. People just aren't seeing this clearly. And I mostly want to talk to those of you who have a family member, a spouse, or you yourself experience symptoms that are disturbing to you and create trauma and hardship in your life. So whether you're in relationship with a family member or a spouse, or it's you yourself, it creates pain and trauma and hardship. And I want to start reaching out, and just at least within the community of people who actively care about this, let's start talking about it differently. These are symptoms. You are not your disease. You have a disease. Even if the medical community is stupid enough to tell you you don't, you have a disease. Something is attacking your brain. Something has attacked your brain. I'm going to say it again. Something has attacked your system, your organs, your brain. Your brain is an organ. Something is basically invading your system. We're going to just metaphorically, because it's the way we talk about cancer. Cancer, we began to talk about it differently. Something has invaded your cells. They're cancer cells that are seen as attackers. And so we can look at cancer victims and see they're under attack, right? So then we have empathy and compassion and feeling for people and the families of people who have cancer, because we think, well, they're under attack. How terrible. Their systems are under attack. Same thing with heart disease. The way we think about it is there are these blockages, these things that come in from outside and start to gum up your system and create heart disease. So it's this thing from outside. It's the way we start to frame it for ourselves, our families, and medicine. It's framed in a way that's like something's in your system that's creating a problem. With mental illness, we do not have this conversation the same way. We do not frame it the same way. The tendency viscerally and emotionally is when somebody is behaving in a disturbing or off kind of way, we think that person is off. We think that person is disturbing. And it would be just as crazy. This is a crazy way to look at crazy. Because with cancer, we do not say that, again, that person is cancer, is the thing that's attacking it. We don't say the person is a heart disease or is a clog of their arteries. We understand that person is the victim of something that's attacking its system. And then when we look at it that way, we can actually find solutions. The problem in the mental illness industry, I'm speaking, of the medical community at large. And I know there are individuals who are trying to, I'm not speaking to each individual in the medical community, but as a whole, the medical community has failed mental illness. It is completely, and as a society, we are failing mental illness and treating it effectively. And again, I said it's something that impacts everybody. And you know why? Because we're not treating it effectively. So the main message here is with yourself and with family members and people you know, start to train yourself to think this person isn't bipolar or schizophrenic. They have a disease that causes schizophrenia. This person has a disease that causes bipolar. And I don't care, again, I don't care, doctors as a whole in a community can be stupid and blind. So they may say, oh, no, it's not a disease, but it actually is. It's something attacking the system. It's something that's attacking the system and creating the symptoms, the disturbing symptoms we see through someone's behavior. So again, you are not the same as your disease. You are not the same, and your loved one is not the same. They are a person who has a disease attacking their system, which happens to be their brain. And that's the main message I want to get across today. So important to start reframing this. You aren't your disease. Something's attacking your system and giving you symptoms of schizophrenia, symptoms of depression, symptoms of anxiety, symptoms of bipolar or borderline or whatever. Something has attacked your system and attacked your brain, and you are not the same as the thing attacking you. Okay? All right, I'm done. Off my soapbox.